Hello, everybody. This
Welcome
is
back.
welcome back to our show, Wednesday Night with Two Ladies. I am Pauline Teo, and this is
Rocking Rachel. So, how is everybody doing today? I hope all of y'all
yeah,
have gotten your vaccination shots because today we're going to be touching on that topic about COVID
that's
19.
right. All about COVID. All about COVID. So I think it's actually good that we keep ourselves updated as well. On the status of COVID, and more importantly, right, how do we protect ourselves so that our loved ones, ourselves, can continue with our livelihood without having any disruptions, right? So, okay,
Yeah.
just very quickly, let's just talk about Wednesday Night with Two Ladies. Who are we and what are we all about? So, Wednesday Night Two Ladies, we actually meet online live uh, every month, two times a month, okay? And we do this show fortnightly. And predominantly, we actually cover four main topics, okay? Which is number one, self love, two, relationships, number three, health, which is what we'll be discussing today. And number four, we actually talk about parenting as well. So today, I believe, Rachel, we are on our sixth episode, right? So,
Yeah. So, like Pauline said, we do this every bi weekly or fortnightly. And
yeah,
we talk about many good, all these topics. So, if you're interested in topics like this, we would suggest that you subscribe to our channel. I think the
that's right.
subscribe button should be on your right hand side. Yeah, so
Yeah.
that way you'll get notified whenever we have a live session. And if you're interested in topic, you can always join us in.
That's right. So I think that's the best way to actually, get notifications as well, so you don't miss out on any great stuff that's being shared. Okay,
Yeah.
so I think let's not take too much of time because we've got a very interesting topic to cover today. So let's just very quickly just look into who the speaker is for today. And Rachel.
So today we have Dr. David Netto. So he is a medical doctor with the Ministry of Health. Okay, in more specifically, he works in he's actually based in Port Dickson. So he's what do you call it? He works both at government clinics and he's also a part time at a private clinic lah in Port Dickson Center. All right,
Yeah.
so he's been with MOH for about 15 years already. That's quite long, right, Colin?
Yeah,
And
that's right. He's got lots of experience in, the medical field.
yeah, so he's mainly focused on primary care. He's been doing that for the past 12 years.
Yeah.
And he basically has more like credentials in terms of family medicine, dermatology, which is good for skin disease and all, and occupational medicine. That's something quite unique. So
That's right.
maybe you guys want to know more about it, you can always reach out to him later on.
Yeah.
All right.
So just very quickly as well, we want to let you know in 2 weeks' time we'll be actually having another speaker on, and if you are interested in the topic, you would definitely want to save the date. Okay, and do you want to introduce who the next speaker is, Rachel?
Yes. So we've got this very handsome guy. His name is Aiden Liu. Yeah, so he's coming on to talk about what makes a good employer in the eyes of employees. So I think this is quite a good topic for both employers and employees, right, Colin?
That's right. That's right.
So
You
yeah,
know,
so
so
you want to find out how to be a good employer, or you want to find out how to choose the right employer, you should come on next in 2 weeks' time to find out from Aiden Liu on what he has to share.
that's right. So back again today, we have Dr. David Nato, and I am going to bring him on now. Hello, Doctor. Welcome to Wednesday Night Two Ladies.
Very good
Hi,
evening to you,
Doctor.
Pauline and Rachel.
Hi.
Good
It
evening.
feels it's a privilege to be with you two ladies in this talk show here, right?
Thank you. Thank you.
Yeah, it's
It's a
great to
privilege to
have you
have
on
you
the
on.
show.
Likewise, I'm
Yeah,
actually kind of eager to share all my knowledge and the essential message I need to convey to everyone
right.
here pertaining this topic here on COVID-19.
That's right. I think without wasting too much time, let's go to the very first question. Okay, so let's start. So, Doctor, as a frontliner, how is the current situation in government clinics or even the hospitals?
Okay, I would have to say things are actually improving. Okay, in terms of COVID ICU admissions, the numbers are decreasing. That's actually very good news. Both
That's great.
Okay, and the I would just have to say that it's going to be today we have about 14,000 cases, and
Mhm.
so the numbers are decreasing in numbers. So take it positively, all because of the vaccination. All right, and then more efforts is going to be implemented as of you already been informed. COVID vaccination is going to be given to all the school children and then students of the tertiary education levels here.
Right.
So currently, this is the scenario here, and things are actually getting better.
That's good.
That's wonderful to hear. I think that's a relief.
Wonderful news for Malaysians. Yeah.
Yeah, yeah, it is. It is.
Yeah, it
Mm-hmm.
is. It is. I think
Mm-hmm.
actually, Pauline, the next slide, could you just bring it up? The
Yeah,
Kyrie actually announced yesterday that we've reached herd immunity already by touching eighty
that's right.
percent of vaccinated adults, which I think is
Yeah.
really good. So what I did was
Mm-hmm.
I asked my friends on Instagram what did they think. 64% of them are still concerned with this
Yeah,
issue. So I was just
that's
wondering,
true.
doctor, what do you think? Is it still safe? Like, with 80% vaccinated, and you see a lot of businesses opening up nowadays. Do you think it's still safe to, go out or sort of like go back to the normal way of living? What's your
Okay.
opinion on this?
I would just have to say that still people have to take the precautionary measures. They have to adhere to the SOPs. Otherwise, they're just asking for trouble there unnecessarily. Okay, and
Right.
attitudes of or the mindset of the people need to be changed. Okay, they should not be so complacent. Okay, and to actually adhere to the rules that's been advised to them. Okay, because because you would just have to make just one mistake, and after that, rest is history there. Okay, and
Yeah.
Yeah.
I sincerely hope that everybody uh, um, maintains practices the SOP that has been heavily been advocated, and then later on we will actually remind you all as to what are the three what are the things that needs to be taken and not to be practiced. It will be highlighted
Right.
later.
So
Okay.
basically,
That's
if we are all following SOPs, we should be okay, lah. As long as SOPs are followed, businesses can run, economy can
yeah.
go back to sort of normal, lah, right?
Definitely, yeah, it's actually essential for Malaysians here. Now, with a number of unemployments and people entirely in need of money and food and all, it's rather depressing. And so, therefore, things need to be changed, and
Yeah.
things need to get moving so that a country can actually run normally.
Yeah.
That's true.
Yeah.
Very true.
Yeah, I
Right.
think if we were to be asking you on the next question, right, it's actually on some statistics that we have gotten this morning when I actually posted this question on for
Hmm.
parents, right, who have kids who are going to school, and assuming kids are going to, I mean, the school's going to open, tomorrow. So, what are some of the parents' thoughts, to send the kids to school? And as you can see here, 76% of parents are still thinking no. I'm definitely not sending my kids back to school, right? And I think with this said, right, what is very curious for us to find out from you would be, with the number of cases increasing, or it's still on a pretty high side currently, even though it's come down by a little bit, how can we best protect ourselves as adults and also our kids?
Okay.
Okay, so
Yeah.
it's very simple actually. So you just observe the three W's and try to avoid the three C's. Okay, so
Ah,
and okay, thank you, Pauline, for actually showing this picture here. So
right.
what we need to actually avoid is avoid crowded places, confined spaces, and close conversations with people with individuals here. Always wear
Right.
your mask, wash your hands, and watch your distance. And of course you have to do the necessary things such as not to shake hands, the cough etiquettes, use disinfectants, okay, and get
Mm,
treatment that is necessary here.
right. Right.
Yeah.
I think these are really good pointers, that we still have to make sure these SOPs, let's not take them for granted, right? We still need to make sure that, we avoid the three C's, we practice the three W's. And it comes to the next question, right? When we talk about, practicing all these, right? Are we wearing our mask right? Because
Okay,
even, the assumption is all of us are already wearing the mask, right? And most of us already have gotten the vaccination. So
okay.
why are numbers climbing?
Why numbers are climbing? So, okay, first
Yeah.
of all, the numbers are climbing is because of other various reasons here. Okay, now
Okay.
I will highlight, I will just mention seven points here. One is the virulence of the Delta virus.
Okay.
Currently we have the Delta virus, which is actually vicious and it is actually deadly here. And, we have other strains such as alpha, beta, gamma, and then lambda. All right, and we wouldn't know how vicious, or it can be more vicious lambda in
I see.
in causing the mortalities or the infection
Right.
there. All right. So the next pointer is actually people not getting themselves vaccinated here. All right, and so that's why they can see still a high rise of numbers here. All right, okay. And the most important one, no adherence to the SOPs here because of complacency of irresponsible individuals here. As you can actually had seen the news on social media where um, certain individuals or guests have actually gone into the beachside in Johor, Penang, and Malacca, and even in my own hometown. And this is where I have to actually applaud onto the PDRM and actually issuing the summonses of those who actually do not comply to the rules. For instance, there are some individuals that are just vaccinated just once, and they just directly just go to the social area, the beach area there with other people there, and therefore it is actually justifiable that they get all the summons that's necessary here, right? Okay,
Right.
so other factors are actually overcrowding in common places like the mall. Okay, but
Yeah, the mall is very
surprisingly,
crowded.
I hear. I mean, it's not so much as I can to the places that I've gone to. Okay, so other factors are areas of common exposure. For instance, in the prayer rooms, pantry, in the cafeteria, smoking zones, and sharing of vehicles that can be
Right.
easily transmitted there because and it's close contact here, right? Okay,
Okay.
and point number six is late detection and isolation of cases here. All right. So you see,
Right.
because certain cases it can be asymptomatic, and then you wouldn't know, whether they're infected or not. All right, because it takes more than 5 days for the virus to set in, and then it actually
Right.
elicits its clinical symptoms there. All right. So the people that
Okay.
have been in contact with that person, they were actually would have been exposed as well. All right.
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 So and the final point is a lack of education and misinformation has been interpreted by many parties here. All right, and lack of education also. Some of them are IT illiterate, and they wouldn't know how to register via My Sejahterah, and
Right.
so therefore we have this kind of situations here. And so, luckily, the government has taken great steps here and in providing the essential service to the rakyat. And, for instance, like in my health clinic, they have a booth to actually assist all the people in need to actually get themselves registered with My Sejahtera. Okay. And the other service is actually we are going to the outskirts in providing the vaccination, especially to the indigenous people. Okay, so a lot has been done here.
Doctor, I have
A
a
lot has been
question for
done.
you.
Yeah,
What do you call this? You mentioned just now that lack of the responding time to getting the treatment is quite bad, right, in Malaysia. That's why we see a lot of cases arriving in the hospital dead as well.
yeah.
So, how do you suppose we educate ourselves on this matter? Because where do you think Malaysians should go to educate more on how do you find out if you're asymptomatic or what should you do the moment you are detected?
Okay,
That's
so
true.
this is a very uh, this is a situation in which okay you will have to be aware of your surroundings, of the people that's been infected, and you should actually reflect onto your actions and whether or not you've taken the necessary SOPs. And if you do have symptoms, please, especially if it's just fever, headache, flu, cough, and diarrhea, difficulty breathing, please go to the nearest clinic kesihatan or the nearest clinic to get the necessary um, uh, you know, management, the service
Treatment lah.
that's actually needed here. Okay,
Yes.
asymptomatic, yes, it's a very dangerous situation there. But then they will have to be aware as to how. And if they feel there's a hunch that they actually have a high risk, they can actually do the swab test.
Mm.
Okay, there's a nasopharyngeal swab or pharyngeal swab, and also the saliva test here. Saliva test is the one that is actually very fast. Okay, and the accuracy and specificity and sensitivity is also high, right? But nothing can be more accurate than the nasal swab and the
Swab
oral
test.
swab
Okay.
test. Yeah. Mm.
Right. Okay.
You
So,
always
doctor.
have to be very. You have to be aware of your actions there, right, and the
Okay.
surroundings. Mm.
Okay, so doctor, back to the question earlier on that we have on the, protecting ourselves and, you did mention that, some of us may not even be wearing the mask, right?
Okay. Yeah.
Right.
Correct.
So can you
Correct.
maybe share with us, like, what is the right way of putting on a mask?
Okay. So I will just first of all, you should
Yeah.
get quality mask. Okay. And this trend of actually trying to buy the mask from Shopee and Lazada and all, and then you can see the quality that is actually not has been advertised here. One important thing that you actually have to remember is this: it needs to be sealed tightly around your and your oral area. Okay. So
Do you want to show us like how it's
That was
yeah, being worn?
okay, definitely. So this is the mask. All right. This is the mask. Okay. So what you can do is the end of it, you just twist it and then put it into the nasal side, one side of your ear, and also onto the other side. You just twist it and then hook it in into the other ear, and make sure it's all close around the nasal area and the orifice of the around the oral area is nicely closed. And also,
Okay.
and also uh, to be safer, it's better for you to wear a face shield. Okay,
Right.
and you can wear a double mask. Okay, the double mask, I need to actually inform everyone here. All right, the disposable mask should be worn internally. Okay, and then the the non-disposable one in which you can ideally put it into your nasal area and oral area should be the external covering there. Okay, that is the one that has been advised. Okay,
Okay.
right? So and yes, and you can the other option is actually you can use a N95 mask. N95 mask seals very tightly around the nasal and then the mouth
The
regions.
mouth area. Okay.
Yeah.
So, doctor, if let's say, some of them that wear a proper mask in on the first layer, right, covering our mouth and also the nose area, and then another cloth mask or maybe another an additional mask on the outside, would
Yeah.
that actually be sufficient?
See, as what you can see in the diagram in the picture here, it's by percentage, and the higher the percentage of efficacy of hindrance of the virus entering here, it'll be a better result for everybody here. So it's actually advisable, and it's actually compulsory for everybody to do all this right now. Okay, and if you
Right.
feel it's rather uncomfortable for you to wear the double mask, wear a face shield. Okay,
Hmm.
and then just wear a single layer a single layer mask. Okay, KKM
Right.
has actually advised us to wear double mask and with the face shield here. But you have to understand it can be a little bit suffocating and very uncomfortable at times, right? So
Mm.
I just hope that you do all the necessary precautionary measures, safety
Yeah.
measures for yourself, and then strict adherence to the SOP, and I'm sure that you'll be fine.
Okay, so I think there is a question that Vivian actually asked with regards to vaccination. So she wants to know, is there any chances that we have to go for the third dose of vaccination? Any updates or news on that?
Okay. As for the third vaccination, the priority will be given to the medical officers and the frontline uh, for patients who are actually with a lot of comorbids. For instance, the elderly people, diabetes, cancer, right? Children with who are malnourished also have cancer and underlying medical conditions here, and priority will be given also to those who are in the care centers, right? Uh, so that as that is the latest news that is actually being circulated here.
Right, right.
Yeah.
Yeah,
Right.
so everybody has to be patient and then to wait for the answers for the third dosing thing because priority will be given to us as what you have actually witnessed in the month of March this year, where the rollout of the vaccines, all of us were given the priority. Sooner or later, you definitely will get it.
Right, right.
Correct.
So with this said, right, the children are now also encouraged to get their vaccinations done, isn't it,
Yes,
doctor?
yes,
So
it is.
with regards to the vaccination, right, is there any guidelines, that is advisable for, children to be taking out of the,
This
approved vaccines that we have today?
okay. The It is actually advisable for all the school kids to take the vaccine. All right. Um, okay. So because you will have to understand that this COVID infection is an airborne disease, and anybody is actually susceptible to actually getting it. Okay, it's better
Right.
for you to protect yourself. It's actually that's why we highly advocate on vaccination. All right. Okay, and so um okay, children, I would just have to tell you this. Should we touch on the topic of concerned parents onto this topic right
Yeah,
now,
I think
Pauline?
I think uh, I think it's actually quite an interesting topic now. Like a lot of parents
Okay,
are
it's a
feeling,
very contentious issue
uneasy.
here.
Yeah.
It's a very contentious issue surrounding the concerned parents there. All right, okay,
Mm.
and to the point that is actually shrouded they are rational and then thinking very logically. All right,
Mm.
but they are. I wouldn't blame them. They are actually human beings there. And so I
Yeah.
will just need to explain on the for the situation in children. Now, everybody needs to understand this. Okay, so the COVID virus actually enters into the nasal cavity. Okay, and then it goes into the lungs. In the lungs, okay, the virus would sit onto the ACE receptors. Okay, in the lungs, but the good news is actually children don't have that much of ACE receptors in the lung. Okay, but as they grow up, the number of ACE receptors will be there. Okay, therefore, an easy tendency for them to get infection. Okay, that's why if you can actually notice that the symptoms that they get are usually mild. Okay, and the younger ones hardly any cases there unless and until they have actually underlying comorbids. Okay, now I just need to actually inform you that you're actually worried about the mortalities there. Okay, now as years ago, according to clinical situation, all right, so the mortalities actually occurs in children or the people in the younger age group that have actually got comorbids. For instance, malnourishment. Those are children who got HIV, children who got leukemia, okay, chronic lung disease, chronic kidney disease. They are actually susceptible to actually get infection, and hence that will lead into mortality there. Okay, right? So Otherwise, it's just mild. Okay. And if you had actually observed on the data that has been circulating here, okay, right, and if you had actually noticed that the high number of cases that's actually happening in Malaysia here, and if you have noticed that schools are not open, but the numbers are still high. So what does that
Yeah.
actually tell you? It's actually due to community transmission. Okay, and so the community, actually we have the adults and the children there. Okay, but it's everyone there. So that's the reason, the main reason why there's a high number of cases of COVID in Malaysia there is because of community transmission. Okay.
Right.
Mm-mm-mm.
So
uh,
basically, how do we actually control this community transmission from happening then? Assuming that we actually follow the SOPs. Is the
Sorry.
chances actually much lower if, let's say, we follow the SOPs?
Definitely. Okay. So what is being advised or advocated here? Get yourself vaccinated. Okay.
Yeah.
Strict adherence to the SOPs. Be aware. Be conscious of your surroundings. You know, and everything will turn out fine. Okay.
Right.
So on the okay. So on the topic of children now and concerned parents and going to school, okay, it's not that it's going to happen tomorrow that the schools are going to be opening, right? Okay,
Mhm.
even in my hometown in Port Dickson, all right, all Negeri Sembilan is in Fasa Tiga, all right. So,
Yeah.
but school children in standard one, standard two are not still not allowed, okay, be it also for the ones who are going for exams,
Mm.
all right.
Okay.
So, uh, so there's a you all have to understand that okay so, schools need to be started. Okay, it's the essential thing that a child needs to to go to actually gain knowledge and also to think about their mental, emotional, and social well-being. You know, the interaction with children here. You see, because how much can you learn from online tutorials here? Don't tell me. Okay, for those who are actually exam going, those who are going for biology, physics, and chemistry, or even lukisan kejuruteraan, okay, kemahiran hidup. How are they actually going to do the project if they are not being guided well? Of course, they will need to be present in the class there, right? Okay.
Yeah. Yeah.
So therefore, parents need to be aware that actually their children eventually will need to go to school. All right. So this is the part that we need to actually advise and educate the children as to what are the precautionary steps that needs to be taken. Okay. For instance, okay, what I heard is this, and moment the schools are going to be open, okay, that is going to be physical distancing, and children are advised to wear mask. Okay, if they can wear a face shield, let it be. It will be better for them. Okay, so there's going to be half the number of students in each class. Okay, but they will go on rotations. Week number one, this group, and then yeah, following week another group. Okay, also school kids are not actually advised not to share their stationery or cutleries. Okay,
Right.
when having their meal, it's better for them to bring a meal from home, all right, sandwiches or so, whatever it is, and then they
Hmm.
eat in their own classroom. Do not go to the cafeteria. Okay, I did say that one of the common places to actually get is in cafeteria there. All right. Also,
Yeah.
um, uh, the teachers need to be a little bit more proactive. Okay, so they will actually WhatsApp to the parents that their children are actually doing fine. Okay, they will actually monitor the students that each of them will have a smartphone, and then with the My Suggestor, check in, check the temperature, and everything is going according to the plan. So because right now, like in my workplace, we have a Google link in which we need to
Hmm.
report, our attendance and what is our temperature, whether we have symptoms, and or whether or not we are present at work. So the same
Right.
application needs to be applied there, right? Okay. So another thing I would have to say is the most important one I feel is in my observation here is always wash your hands. Okay. So this hand sanitizer needs to be provided to children, and each they should actually wash, clean their hands frequently. Okay.
Right.
Even before they go home or any activity, please wash their hands with sanitizers.
Right. Right.
Yeah.
I
That is
think
my
these
advice.
are I think these are really very good tips, that doctor have just shared with all of us. Again, it's just to be mindful of the SOPs. So for those of you who have just tuned in, right, just remember that you need to avoid three C's and practice the three W's. Okay. So for the time being now, I'd like to just very quickly, right, take a short, a session just to say hello to some of our guests here. We have, Vivian with us. We also
Yeah.
have CA. Okay, that's actually
Hi,
tuned in as
Jane.
well. Yeah, and they've also said hello also to Dr. David.
Hello,
Okay, and I
Vivian.
think Dr. David, you've got a fan here, Connie, that's actually tuned in as well,
Yeah.
joining
Hi,
us.
Connie. Hi, Connie.
Yes. So I think for some of you who have are still tuning in here, and we don't know who is actually on, do drop us a line and say hi. So at least we know, and we can actually properly acknowledge you as well. That you are here with us. So now moving on, I think Rachel, you've got the next question to ask, Doctor, right?
Yes. So, Doctor, just now while you were sharing us the steps to prevent, to take precautions and all, you mentioned this one particular line that the timing to treatment is very, very crucial. So,
Yeah,
as that's very true in all health conditions, not just COVID, right? Even other
Yeah,
illnesses
definitely.
and it's all the timing is the most important thing. So with government hospitals, as we seen during the peak of this COVID-19 in Malaysia, we saw many government hospitals flooded with a lot of people until some patients were even on the floor. So with this
yeah,
being said, there's literally no space for people because government hospitals are also there to what is provide for people with other illnesses such as cancer or heart attack, those or even normal accident cases also. People
correct.
generally go to government hospitals. So
Yeah.
with this being said, would you say that a medical card right now is extremely crucial because what do you call this? We have the option for a different alternative of treatment rather than just relying on one source.
What you actually said is actually very true, and I fully support uh, your suggestion there, yeah, Rachel. Okay, and again here, a medical card is subject to one's affordability, whether you actually can pay for it. Okay, and we are not actually insisting that you should, but we are suggesting that one should have a medical card here. Okay, for instance, it's like this is because of the high admission of COVID cases, and so surgical wards and other wards that have been need to be need to make way for the COVID admission there. Okay, and so there's going to be postponement and delaying of less important cases. For instance, I actually seen a case where a person who's got stage one cancer has actually moved to stage three cancer
Oh,
there. Okay, so it was a very unfortunate incident for this particular person here, right?
yeah,
And
yeah,
and stage three is it's quite serious there. There's going to be radical intervention, and that's going to be performed by the specialist,
yeah,
right? So if you can, what Rachel has suggested is it's a very uh, good reason for you to get a medical card there. It is because you can use that medical card and you can seek the faster service at a private hospital there, and they are actually willing to take you in, all right, based on your clinical condition, and definitely you will be uh, your your medical process will be apprehended early. It's better to tackle early than to pay for the price of it later.
right.
Yeah,
Yeah.
that's
Okay.
true.
I think, Doctor, you've
I'm sorry, Pauline and Rachel.
yeah,
Just to add in additional notes onto the medical card
sure.
here. Now, people may think it as a liability, yeah? All right. But look at the situation that is just arise. Okay. Now there are people those who have already succumbed to death. Okay. Unfortunately,
Mm,
it's because of COVID infection. For your information, a medical card can be supplemented with life and critical illness. Okay, so in the event, let's say somebody dies, you're in the demise, the next of kin can actually inherit the privilege there. Okay, let's say it's 100,000, they can actually get the rewards of just 100,000 there, and also, uh, you know. Even though if you don't use the medical card, look at the cash value returns at the end of the term there. Perhaps it can be a good value for your retirement there. That's it. I'm just going to supplement that and complement that. That's all.
Yeah,
Thank you,
I think
Doctor.
those are really good points that you've just brought up with regards to having options, okay, during time like this, instead of just 100% relying on our government hospital. At
Yeah.
least you know that you've got a medical card to safeguard, your interests, and you have the option to go to a private hospital, at least to seek for some medical advice or even to take necessary next steps if needed to,
And things can be hastened up there, right? Okay.
that's right.
And then with the holistic treatment, it can be provided to you. Also,
Yeah,
another clinical picture is like this: a patient has got diabetes and hypertension, and he's got hyper intolerance. It can signify a very bad heart problem there. Okay, so what
yeah,
is the next thing that we'll do is we refer to the hospital, district hospitals, for ECG and echocardiogram. Okay, in which the waiting time it can be long, but
yeah,
if you have a medical card, everything can be expedited there. All right,
yes,
and who
yes.
knows if you need to undergo a bypass, it's there available there.
That's right. That's
Yeah.
right. So, doctor, on also
Okay.
on this point now, because we are going through this phase of COVID, right?
Yeah.
So, example, from what you've just mentioned on, the government hospitals now are really, really packed, and I think in some ways, in some cases, a lot of them are very concerned with regards to, if they do take a private hospital as the next, option for them to actually seek treatment for COVID cases, right? I understand that the medical bill really is very super high. Is that correct?
It is actually true, and I've actually seen it myself. I wouldn't want to actually mention which private hospital is this.
Yeah.
Okay, so let me just be very frank with you. The bill actually came up to $350,000
That's
in
right.
the for the cost of stay for that patient there. And
Yeah.
who knows, it would have been as it could have been just 14 days, 21, or maybe a month there. Okay,
That's
and
right.
definitely nobody's going to fork out 350,000 cash and just pay it like that. It'll be, it's better for you to actually, have a medical card that actually can cover you up for all this, right?
That's right. That's right.
Mm,
And I think, even with that said, I think what is very important, what we want to highlight here, right, is again the SOPs are not to be taken lightly. We
yes.
really need to do our part to make sure that we practice the SOPs so
Mm-hmm.
that we can better take care of ourselves. Okay, instead
Yes.
of having to pay such hefty bills,
Yeah,
and have all this pain incurred unnecessarily. So
I
I
agree with
think,
you.
Doctor, there is a question that is pertaining to vaccination. Okay, so basically, uh, Mr. Lau here wants to understand. Can you actually explain the safety of the vaccine, since pre-COVID vaccine trials takes a long time? So I'm guessing that he wants to find out what's the potential side effects, or is there any difference
Okay.
between the different vaccines that we have out here in the market? Can you elaborate a
Okay,
little bit?
so the efficacy of it will range from about 95%, 90 to 95%. It depends if it's whether Pfizer, Sinovac, or AstraZeneca. Okay, Moderna. All right. Okay, but
Okay.
as I said, it ranges from 90 to 95%. Yeah? Okay, so the common side effect that everybody will actually experience is this. Okay, in which will it be seen in the first 24 to 48 hours. Okay, it is actually kind of normal. Don't have to be so
Mhm.
worried about it. Okay, the symptoms can be just fever. It can be fever, by the way. Fever, headache, nausea, giddiness, body weakness. It can also present as diarrhea. Yeah, but
I
if
see.
it's just going to be there for the first 2 or 3 days, but after that, in the day four of your illness, let's say it's the day four after your vaccination, and you still develop that, okay, then seek just the medical intervention that's necessary lah. Yeah, you go and see a doctor and you take the necessary medication, but of course you actually provide the full history whether or not you're actually taking the vaccine or it's a new case here. It's a very important thing.
Right.
Mm,
Right.
yeah.
But in terms of the vaccination itself, right, do you foresee any potential side effects?
Side effects. Okay. So,
I mean, on the long-term basis, rather than because this is actually a very a vaccine that came out super fast, right, compared to the
so,
other vaccines
so
in history.
definitely people have there's been highlighted onto the media and into social media access and all. Okay, right.
Right.
But the tendency for you to get the side effect is very minimal. For instance, the most concerned side effect would be, like blood clots post vaccination, and of course the one that is that's worrying the parents right now is actually myocarditis is after receiving the
Right.
vaccination there. Okay, so now I need to tell you this myocarditis. It can be the symptoms that can be just chest pain, difficulty in breathing, and palpitations, heart palpitations there. But it can
Okay.
just be very mild. It's not going to be severe, by the way.
Mm,
Okay, right?
okay.
And the percentage of one to actually acquire that of the side effect is minimal. All right.
Right. Right.
So you should not put that as your main concern there. The main concern is for you to be safe, okay, and to get yourself vaccinated. So only then you can actually get things going in your life. There,
Right.
right? So the other side effects of it is all trivial, nothing to be worried about there. Mm.
Okay. Okay. So I'm just wondering whether there's any other questions or clarifications required by the audience out there. You guys have been awfully quiet, so so
Okay.
maybe what you guys can also do is from the sharing today, you could maybe type up on what you've kind of like find the most important point that you have picked up from today's sharing. So at least we know that you're still with us. Okay. So, doctor, before we kind of like end today's session, right? Because I think most of the questions you've actually answered already. So, what is your main advice for the audience out here? How do they actually protect themselves and also their loved ones, especially the kids, from COVID?
Okay. Basically, it's just a reiteration of what we have been saying in the first few minutes of the show. Okay, strict
Right.
adherence to the SOP, and make sure you get yourselves and your family members and your kids vaccinated. There. Okay, do live a healthy lifestyle. Okay, uh, eat more greens and fruits. Okay, make sure you get the exercise of 30 minutes a day, 5 times a week. Okay, less red meat consumption. Okay, and just maximize your intake of vitamin C. Okay, so the supplements it would be vitamin D, 1,000 international units of vitamin D per day, and that is actually acquired via sunlight exposure from 7 o'clock to 10 o'clock in the morning. Okay, because that's when the UV rays are safe index. Because after
Right.
11, after 10 o'clock, it is very it can be potentially cancerous there. Okay, I'm just telling you,
Okay.
son,
Okay.
so take you can supplement yourself with vitamin C, B3, B7, zinc, and magnesium. All right, that is
Okay.
actually um, it can actually boost up your immunity to in this current time. Okay,
Right.
and yeah, stay safe and stay healthy, and I hope that everybody is um, emotionally happy, mentally strong. Okay,
Okay.
and during this time, and if at all you have any problems, do seek the service of the hotlines, okay, or to the nearest medical center, to your nearest doctor. We are ever willing to actually help you here. Okay, as one has already noticed that the cases of depression and anxiety, okay, and obsessive compulsive disorder here. All right, it's no joke. Okay, and suicide
Yeah.
is also present as a result of depression. Okay, and yeah, and get yourself vaccinated.
Yeah, I think that's the basic things that we can do as Malaysians in order to protect our loved ones as well as Malaysians in general. So I think, Doctor, there's an interesting question here that we have from the audience. Okay, So basically, Lau Hiu still wants to understand, will we face a similar possible scenario as what's going on in Israel? Okay, whereby 80% vaccinated population with many vaccinated people ending up in ICU and the Delta variant wave going high up. What do you think it's the likelihood of it like happening here in Malaysia? Considering we are also 80% adult population being vaccinated, right? So yeah.
Mm. Okay, I shouldn't sound so pessimistic about this. Okay, that it will actually happen,
Mm,
but let's not hope that will actually happen here. All right. So I wouldn't. I cannot explain as to why there have been a lot of cases of ICU admissions in Israel.
right,
Okay, and because it's a different country, it's a different scenario there. I wouldn't know how the policies are, the SOPs and all. Okay,
right,
so of a the possibility of it occurring here, I did not say anything. All right. I don't sound so pessimistic. So I just advise you that, we just hope for the best for everybody, for every individual. We have to advocate on safety and we have to be alert. Most important thing is we need to share the knowledge to everyone, okay? Because they can be ignorance. There
yeah,
can be ignorant people here in the society, and then adamant, and you cannot do anything about that. All right. Um, so I hope that it does not happen, but we just have to wait and see, and we pray that for the best.
right, right. So I think yeah, that's the most important thing. All of us need to take the responsibility, to take care of ourselves so that we can take care of people around us as well. So again, SOPs is very very important. Okay,
It
from what
is.
I personally gathered, okay, from today's session from Dr. David's sharing is that the the three C's we should try to avoid it. The three W, practice more, okay, and make sure that we don't take any of it for granted, that it's safe out there, because everyone's going out. I know all of us are pretty much depressed to a certain degree, being home for so long. But again,
Exactly. Yeah.
when we are actually allowed to go outside, please still
Sense of
be
freedom
very
there.
mindful that
Yeah.
COVID is still around. We still need to take precautions so that we can actually stay safe.
Okay.
Okay,
COVID.
so
It's just to say that COVID is not going to be. It's not going to disappear in about 6 months or 1 year. It's going to be long. All right. And so
yeah,
we have to wait for time. For only then it will actually decrease in number. Okay. So
right.
we hope for that. You know, uh, for that to be achieved.
Yeah.
Yeah.
Right. Definitely. I think that's the least we all can do, as Malaysians. Just play our part, follow the SOPs, and make sure we wear the mask right. Okay, and double mask if we really can, so we can protect ourselves. And we should all be pretty much well. So I think with that said, Doctor, we really, really like to thank you for your wonderful time spent with us to share so many important information, and also a very good reminder as well, for parents to be rest assured, if you follow the SOPs, given time, things will actually iron itself out, and your little minions will be just fine. Okay, so for some of you who are really interested to, maybe, too shy to ask the questions here, please connect with Dr. David, and he's actually in LinkedIn and he shares very actively, on various medical topics as well. So do connect with him. And if you do have any other concerns with regards to, medical health, please, seek his advice. Okay, I'm sure that Dr. David, you're more than happy to, entertain some of those personal questions that the audience may have.
Yes.
Okay,
No,
yeah,
definitely. Thank you very
yeah.
much, Pauline and Rachel, for
Thank
this
you so much.
opportunity. All right,
Yeah.
to be in this talk show with you all.
Okay, so for the time being, we will need you to be in a backstage for a while we wrap up over here. So we'll see you in a bit. Okay, don't leave us yet.
Sure,
So
sure.
Rachel, so do you want to take on sharing with the rest of us what you have prepared for today's giveaway?
All right. So, thank you all for staying till the end. So, as we heard from Dr. David Netto, that timing is very important. We've seen how good a
Yeah.
medical card. I mean, not how good, lah, but how essential a medical card is at this time
Hmm. Yeah.
in our life. So, the best we can do is basically protect ourselves. So that's why we prepared.
Hmm.
Hold on, bring up the slide. We've prepared
There we go.
special gift for y'all
Hmm.
where we are giving out a complimentary consultation for 15 minutes. What you'll get from this consultation is basically a checklist to protect yourself during this pandemic. So, what we've seen in the spike recently with the MCO and all, we've seen a lot of our friends, some friends of friends, or even some of us, our relatives who have had people pass away from COVID, right? So we've
Yeah,
seen
that's right.
the dreadfulness of it and how scary it can be. So
Yeah,
medical card is just a basic protection, but there are many other protections out there like life insurance, your nomination that needs to all get sorted, even your will writing and all, because
that's
we
right.
are living in a time where we don't know what is going to happen tomorrow. So
That's right.
it's best to actually get a review done on what you already have, so you know that whatever you have is sufficient for what you're leaving behind for your family, and you can have a peace of mind, and what it is, hopefully we get through this without any more hiccups, right? So with
Yeah.
that said, do reach out to us if you want this 15-minute complimentary session. You can
Hmm.
actually find us on LinkedIn, or you can even check out the description below. Our links are there. You can
Yeah.
get in touch with us via Instagram or LinkedIn, and you can request for this 15-minute consultation. It's completely free, and you get this checklist as well as the COVID-19 coverages that's offered from a few insurance companies. So if let's say you are covered, for example, by Allianz or Great Eastern, you will know what kind of cover that they give you. All right.
Yeah.
So
Yeah.
with that being said, do make sure you subscribe to our channel to follow us on the next show. Yep.
Yeah, so I think before we even wrap up, let's just remind you again in 2 weeks' time, we will actually have a very interesting speaker with us. And he is none other than Aidan Liu, who is actually a payroll compliant expert and statutory and HR advisor. And he will definitely be sharing with us what makes a good employer in the eyes of employees. So this will definitely benefit a lot of employers and employees, right? Number one, employers, you want to get good employees, and employees, you want to make sure that you're actually joining a very good company, right? And a good employee is taking care of you. So I think this will be a really great session on the 6th of October at 8:30 p.m. GMT plus 8. We will be having this particular session here with Aiden. So for those of you who are interested, please mark your calendar right now or hit that button, to subscribe to this channel. And we would love to see you in 2 weeks' time and to have that session with you. Okay, so with that said, we will now be signing off. We wish you guys, stay safe. Okay, please take care of yourself and your families. Do take care, and we will see you in 2 weeks' time. Signing off from
Take care,
me
everybody.
and Rocking Rachel.
Bye.
Okay, take care, everyone. Bye.